There are several biomarkers that can help differentiate mesothelioma from other types of cancer. Mesothelioma is a rare form of cancer that develops from the mesothelium, which is the protective lining that covers most of the body's internal organs. The mesothelium forms a sac around the lungs known as a pleura, thus mesothelioma is commonly referred to as pleural mesothelioma. Other less common types are peritoneal mesothelioma, which affects the lining of the abdomen, and pericardial mesothelioma, which affects the lining around the heart. One of the most useful biomarkers for mesothelioma is soluble mesothelin-related peptides, SMRP. SMRP are fragments of mesothelin, a protein found on mesothelial cells. Elevated levels of SMRP in the blood have been correlated with mesothelioma. Studies have found SMRP to be present in over 70% of mesothelioma patients, but rarely elevated in people with other cancers or non-cancerous pleural diseases. However, SMRP levels alone are not definitive for diagnosing mesothelioma, as false positives can occur, so it works best when combined with other tests. Another potential biomarker is osteopontin. Osteopontin is a phosphorylated glycoprotein that helps cancer cells adhere to tissues and supports metastasis. Several studies have found elevated osteopontin levels in the blood, pleural fluid, and tissue of mesothelioma patients compared to people with non-malignant diseases. One study reported that osteopontin had a sensitivity of 94% and specificity of 93% for diagnosing mesothelioma. Like SMRP, osteopontin levels alone cannot confirm mesothelioma but may provide supportive evidence when interpreting test results. Additional biomarkers still being researched include megakaryocyte potentiating factor, MPF, fibulin 3, and cytokeratin fragment 21:1, CIFR 21:1. MPF is secreted by mesothelioma tumors, and elevated MPF levels were found in 58 to 87% of patients in studies. Fibulin 3A appears to be more highly expressed in mesothelioma tissues compared to lung adenocarcinoma. CIFR 21:1 measures fragments of cytokeratin 19, a protein found in mesothelioma cells. Higher levels were reported in 55 to 94% of mesothelioma patients versus healthy individuals. Differentiating mesothelioma from other cancers like lung cancer based on disease location and biomarkers is also important. Malignant pleural effusions, or abnormal fluid buildup between the layers of the pleura, are common in mesothelioma but less common in lung cancer. Analyzing the cell types and biochemical contents of pleural fluid can provide clues. For example, mesothelioma effusions tend to contain high numbers of tumor cells along with lymphocytes and reactive mesothelial cells. In contrast, lung cancer effusions usually have fewer tumor cells and more neutrophil inflammatory cells. The fluid pH also differs, with mesothelioma effusions typically more acidic than those from lung cancer. Mesothelioma tumors express certain biomarkers not typically found in other cancer types as well. By evaluating marker proteins in biopsy tissue samples using immunohistochemistry, pathologists can detect mesothelin, calretinin, WT1, and D240. These are reported to be present in over 70% of mesothelioma cases but rarely expressed in lung adenocarcinoma or other non-mesothelioma cancers. The combination of morphological evaluation and biomarker profiling from cell tissue samples provides information to accurately diagnose mesothelioma and rule out more common lung cancers as the cause. There are multiple biomarkers currently used in clinical practice and under investigation that can aid differentiation of mesothelioma from other cancers based on serological, cytological, and histological analysis. No single biomarker is definitive on its own, but the pattern of biomarker expression in blood, fluid, and tissue specimens can help establish or rule out a diagnosis of mesothelioma versus diseases like lung cancer when findings are integrated with other clinical and radiological exam results. Continued biomarker research aims to find even more specific and sensitive tests to optimally diagnose this rare and aggressive cancer.